5, 4, 3, 2, 1, 0. All engine running. Liftoff. We have a liftoff.
Space and biology. We have another episode on this exciting intersection of deep tech themes. And it won't be the last one. My guest this week is Paul Kamoun from SpacePharma. He also organizes an entire conference on space bio called Health from Space every year. We talk about what use cases he finds most exciting and the opportunities and challenges on the road to scaling space biology into the next big thing. Enjoy. Hey, space enthusiasts, welcome back to another episode of the Space Business Podcast. And this is going to be another episode in a mini series I advertised a while ago when I said I wanted to do more episodes on the intersection of space and biology. The longtime listeners will remember there were some episodes in the past, like for example with Redwire Space and their chief scientific officer, Ken Savin. But today I'm very happy to have as my guest Paul Kamoun, and he is from SpacePharma, and he's both their chief marketing officer as well as the MD for their European business. Welcome, Paul.
Thank you very much for welcoming us.
And so, Paul, as we discussed before the episode, I want to have sort of a broad discussion on the intersection of space and biology, which, I'm biased, I find super exciting, and hopefully our listeners and I know you find super exciting. But before that, we should talk a little bit about your company and yourself as well. So do you want to just give us a summary on what SpacePharma does?
So our company is indeed developing hardware for experiments in space, for R&D, but also for production in space now, related to life science and health. This company has been created in 2012. We did our first flight in 2017, and we have now done about 11 flights to space. My background is from space. I've been working originally in astrophysics when I did my PhD in planetary science, and then I switched to ESA, European Space Agency, and then I went to industry. So I've been in the space industry for the last decades, and I must say that until I discovered SpacePharma and a very innovative company in 2017, I neglected life science. I must admit honestly that Earth observation, telecommunication, space station, navigation were, for me, space. The rest, actually, it was just a small line in the budget of European Space Agency, a few thousands or millions of euro in the budget of the ministerial. But when I met SpacePharma, who won the innovation competition in Paris in 2017, I realized that the next revolution actually is there. And actually, not only in terms of application, but also in terms of business. And that's when I decided to leave the big company and join this startup at the time. So, and I'm still quite exciting as I was in 2017, and even more every day.
Okay, no, thank you for that explanation. And I think it's not only you, I think it's most of us, including myself when I started in space, that, like you said, we imagine space as rockets and satellites, basically, and satellites doing very well-known things like satellite TV and satellite communications and Earth observation and so forth. And those use cases, I think even non-space people understand. They're like, yeah, we use a satellite because it makes the communication more efficient, or we use a satellite because it can observe the Earth from above. But I think space and biology, the intersection, is much less intuitive unless one has studied that a little bit. So why don't we start there, if you don't mind? It's like, why should we even do life sciences and biology in space? What is sort of the equivalent argument to the ones I just made for using satellites?
Yeah. Actually, it's a very important question because that's how I got to get involved there. When you come from astrophysics, like me, the main force in the universe is gravitation at macroscopic level, and you just cannot imagine that gravitation is playing such a role in the microscopic level. You say it's a macroscopic force, and in the microscopic level, you have atomic forces, you have the different forces inside the atom, and so on. But gravitation is something of the big universe. And when I discovered that it's not the case, that gravitation is playing a role even at the nano level, at the very microscopic level, that the gravity parameter is changing everything even at the microscopic level, then I realized that we have to take into account this parameter to understand how biology is working. And by modulating the influence of this parameter, we can understand better the biology. Actually, many phenomena in biology are influenced by gravity, as opposed to what we can believe when we look at it as a physicist. But biologists, I think, are discovering more and more that the gravity parameter is playing a key role in anything from gene expression to bacteria virulence to organ development and functioning and so on. And the fields are really infinite. And we are just starting to discover that.
And so I guess that is the reason we then have to go to space, because if we want to vary the gravity variable, well, which is, on Earth is the famous 1G gravity environment, and on Mars it would be 0.38 and the Moon 0.16. But if you're in free fall, for example, International Space Station, it's basically close to zero, right? I guess that then presupposes, or this explains why we have to go to space, right? Because we want a sustained or longer term, I'm going to
Yeah,
incorrectly call it zero G, or the correct way, I guess, is
right.
microgravity environment. Like we can't
And
do it
it's
on
impossible
Earth.
to simulate on Earth. It's impossible to simulate on Earth. The absence of gravity we find in space. That's why we have to go to space to study this parameter. And people have tried different things, as you know very well. They did simulators, the random positioning machine, and parabolic flights, and just reaching suborbital. But nothing is like being in space really for good. The level of absence of gravity is so low that really that's where you see new phenomena developing, occurring, and that you can and start to understand.
Yeah, because I was going to ask you actually about something like parabolic flights, but parabolic flights, I think many of our listeners know already, that's where an airplane flies repeated parabolas, hence the name, parabolic flights. And at the apex, you have something of typically 15, 20 seconds of microgravity. But I guess the point here for the interesting biological phenomena that you started mentioning examples of, like gene expression and so forth, that's just not enough, right? You need a longer time period.
You're right. You're right. When you do parabolic flight, indeed, not only it's short in time, and you have to do many different up and downs, and at the end, it's still only a few minutes, but also the level of microgravity is much less than what you can get in space. In space, you can get to 10 to the minus 5, 10 to the minus 6 G. With parabolic flight, if you get 10 to the minus 3, you are quite happy. So it's not
Understood.
real absence of gravity.
And so you started mentioning some of the interesting biological effects, like again, gene expression. Do you want to kind of take us through the main ones that we know about, and then maybe also kind of from that we can segue into like what that implies in terms of potential use cases, right? Because one thing is discovering the phenomenon, right? But the second step is to think about what can we actually do with that that's useful for us humans.
Right. I think if we want to take a schematic approach, I would say we have the biochemistry and we have the biology. Biochemistry is much easier to do because you don't have to bring cells and so on. Biology is more complicated. But advances can be identified both in biochemistry and in biology. One of the big applications today in biochemistry is clearly protein crystallization, where we know that now it's well proven that when you start to synthesize protein crystals in space, they are both bigger crystals. You can get polymorphs of crystals, which are impossible to do in the presence of gravity. You can get natural 3D growth. You can get more pure crystals and so on and so forth. So the biochemistry, in particular for protein crystallization, is well proven now to be much more efficient than on Earth. And it has been applied already, like for instance by Merck a few years ago with Keytruda, which is for oncology. But the potential is really huge for many other type of crystals and proteins. Actually, the biochemistry itself is going even beyond protein crystallization because actually all the chemicals that we are trying to to produce. We can use the accelerated production effect as well as the purity for many other things. Actually, this is used not only in life science, but it's used in material science. People are developing, for instance, fiber optics in space because they know that it will be a much, much higher quality of material and so on. So the fact that you can grow materials in space in naturally in 3D, something much more pure, much more homogeneous, because no sedimentation, no convection, is applicable in life science as well as in many, many other fields. And that's why I think in-space manufacturing as a whole has a great future in front of it. It will depend very much, of course, on the type of infrastructure which will be put in place. Of course, if you want to do large quantity, you need big infrastructures. But if you want to do only small quantities, like for instance, for high value active pharmaceutical ingredients, for instance, where you don't need tons like you would need for other things, it's a different story. You might not need as big a system in space. So actually, this biochemistry side is the easiest one to tackle. And the biology one is the more complicated because for biology, you need thermal control, you need late loading to the rocket before launch, you need a lot of different things that you have to manage. But there are many applications of biology, even more than in biochemistry, because biology is focused on the human body. And everybody is able to understand that the complexity of the human body is so large, so great, that we have so much to discover in terms of functioning, in terms of disease, and so on. I believe the field of biology will be even much bigger than the field of biochemistry.
Okay, let's delve into the various things you said a little bit. So let's first take a step back for our listeners, many of whom I suspect are not familiar with space biology and in-space manufacturing, how this all works. So if I just take the example you mentioned, which is Keytruda, like you said, a Merck cancer drug, effectively in crystalline form, and it was discovered that the space crystals were quote unquote much higher quality than what we can get on Earth, and we can get into what the higher quality means here, right? But so for our listeners, the important point being is here's something that we could only do in space or produce in space. But just to be very clear, this is then something to be taken back to Earth as a product. And this is kind of the general theme I think we're going to talk about today, which is we take these biological things or biochemical things, we manipulate them somehow in microgravity or produce something new and or do some analyses, and then we usually take something, not always, but very often we take something back on Earth at the end of the day to benefit humans on Earth. There's of course a whole different field of space biology which would be targeting the health of people in space, astronauts, but let's leave that to one side for the moment.
Yes.
Okay, so now that that's hopefully clear what we're talking about here, let's dive maybe into some examples both on the biology and the biochemical side, and maybe here if there's particular things you're excited about. So yeah, we already spoke about Keytruda as an example of a cancer drug, oncology. Is there anything else in oncology that you find exciting where space might help?
You mean in oncology?
Yes.
Or in other topics of biology
Yes,
and
I just
medicine.
wanted to ideally go through like a few big topics in life sciences in general, and then you can sort of maybe comment, oh yes, you think there's something already very exciting going on in space, or it's not clear yet, or actually the answer might also be no, I'm not aware of anything where space can help here. And so oncology was just my first example.
Yeah, actually, I would say we mentioned a drug considered oncology, but there are many other things that are very useful in oncology, is in particular in the disease modeling. Because the disease modeling is something that you can decompose more easily in space by taking away this gravity parameter, managing the gravity parameter. You can slow down some processes to analyze how they unfold. In particular, we are doing that on an experiment on prions now to understand how the prion folding is happening, because the proliferation of prions, it depends on the protein folding process. This kind of studying of how a cell is modified in time, how the genes are influenced by the environmental parameters, including gravity, how DNA is being changed, and we know that the DNA is fundamental in oncology. So all these processes, space is an extremely interesting environment, but it's a new laboratory essentially. It's a new laboratory with a new environment to be able to study processes in ways that we could not study before. And so I think oncology is definitely one of those big new domains because there are so many research which is going on many different aspects of the cells that is relevant to that. I think another huge domain which is going to emerge is the resistance to antibiotics. And in particular, how to treat antibiotic resistance. I think, and many people in life science agree, that the next big challenge after COVID-19 will be antibiotic resistance. And it doesn't look like such a big issue, but we have plenty of bacteria in our body. Some say like probably a couple kilograms for a normal person, which means that these living beings behave sometimes well, sometimes not so well, but we don't understand really very well what they are doing. And the way that they start to behave when there are antibiotics, it's quite a big issue. And we have a lot to learn about the bacteria life and about bacteria behavior. And I think that will be this whole issue of understanding bacteria and devising new kind of antibiotics to which the body is more able to fight with. I think this is another huge topic. We are working a lot also on another topic, which I think is another very important one, but there are so many of them, I would not describe all of them, but another big one is organ regeneration and
Hmm.
building artificial organs in space, taking advantage of the absence of gravity, absence of sedimentation, convection. You can produce some structures without any scaffold that you would like you would need to do on Earth. And this has huge implications. And we are combining this kind of new advance today with what is done in regenerative vascular research, in particular for artificial skin, but also for many other kind of artificial organs. As you know, skin is an organ, and biologists say that skin is the biggest organ of the body, but lots of things can be done on skin. We flew already some missions for skin, but we can do many more. So I think this is also a huge topic with, again, lots of commercial applications. But before commercial, a lot of importance for the patients.
Okay, and so just to be clear, all of these things you mentioned, if everything goes well at the end, it wouldn't just be research, but we could also have actual products coming out of that, like better oncology drugs, like maybe better antibiotics, like partial or full replacement organs, for the example you mentioned. Okay.
Exactly.
And I think you
Exactly.
hit on many of the things or the sort of life science use cases I wanted to ask you about anyway. One other one which we haven't talked about, which I'm very curious about, if you have a view, would be basically neuroscience, neurology, neurodegenerative diseases, because I know a lot of people have already flown brain organoids and brain experiments to the ISS. What do you think about that line of study in space?
Well, yes, this is a very exciting topic because it combines biochemistry and biology. Because actually it's the use of organoids and your company is a great company in these developments of organoids.
Thank you.
But the fact that not only FDA had a couple years ago accepted preclinical assays on organoids instead of animals, but that more recently FDA has encouraged the use of organoids instead of animals is a kind of game changer for the development of new drugs. In particular, in space, where naturally we can grow organoids, or at least we can bring organoids which can behave like parts of the human body, we can accelerate preclinical assays in ways which will be more readily accepted by regulation authorities. Of course, it takes time. Of course, we have to demonstrate that we are able to do good laboratory practice, good manufacturing practice, but we are on the way. We are very confident that that will be faster than what many people believe, and that will be at the core of the business of company like ours, where we are not expected to do only R&D, but we are definitely targeting production in orbit of what is necessary to improve patient life and therapies.
Okay, and so organoids, just for our listeners who may not know, organoids are basically three-dimensional human, well, they don't have to be human, but basically three-dimensional cell models, which can be interesting in testing and in regenerative medicine as well. But this is coming back to the first part of my question. Is there anything, because I mentioned brain organoids, is there anything on the study of, for example, of neurodegenerative disease models that you find interesting in space?
Yes, actually, this is a very important topic. Neurodegenerative disease are among those who have the least solutions today. And
Like Alzheimer's.
yeah, Alzheimer, Huntington, Parkinson, unfortunately, you name it. And so some of the research we are doing with prions might have consequences on that. We have also another mission which is in preparation, which is on brain tumoroids to fly organoids of brain and brain tumors. We have a flight which is planned within a year. And this is in collaboration with hospitals and with surgeons who bring into our lab real organoids from people. And this has also implications in terms of personalized medicine because you can bring to experiment real cells from real people who need therapy. And this is something very exciting for the future. But yes, indeed, brain is and neurodegenerative disease is also another big domain that we are trying to tackle with one experiment we're going to fly soon, and hopefully it's not a single experiment. We are working on a roadmap. I think it's very important that for people who listen to us that we are not trying to make one shots. When we make R&D in space, whether with the objective of producing or with the objective of understanding how it should be a new therapy, we cannot succeed in a first flight to space in understanding everything. We most likely, most of the time, need 2 or 3 flights with a roadmap, with a team of scientists who understand and plan exactly for which flight what they're gonna try to demonstrate and validate. It's a long process, but nevertheless, I think in many ways it's shorter than on Earth because things can unfold much faster in space. We can get much faster results. In the topic of aging, for instance, we know that human organs age faster in space. We start to understand why. And there are many things where the kinetics of space can be very positive to accelerate innovation and discoveries. And in particular, in these domains, we look forward to that.
So that last part is actually very interesting. So that's what you're saying implies that you think space can help us in the sort of very fashionable topic of longevity research as well.
Indeed. Yes. Yes. Actually, what is very interesting in longevity is it's at the intersection of many different things. Aging and longevity are at the intersection of what happened to any single organ, what's happening to the heart, what's happening to the muscles, what's happening to the bones. For some people, what was gonna age faster will be the heart because of their gene and their, I would say, heritage. For some other people, what's gonna age faster for them will be something else. It will be the lungs. For some other people, it will be the skin. So the topic of aging is really at the intersection of all of those. Of course, neurodegenerative is right in the middle, but I think aging as a whole is more than a social specialty. It's a medical specialty, and it becomes even an economic issue because people are starting to understand that if we reach longevity, and thanks to new technology, it will have an impact on society and economy. So aging and longevity, integrating in them all the possible advancements in life science, as well as political understanding of an ethical approach to what will be tomorrow what tomorrow will be made of. It's very exciting, and we see a lot of people getting interested in longevity for different reasons, not only for science, not only for health, but for other reasons. But indeed, space is a wonderful laboratory to study aging. It's probably the best that we have at our disposal today.
For sure. Okay, we could go on this line and talk about longevity for an entire episode and some other disease models.
Yeah.
I mean, there's many things we haven't even mentioned, like osteoporosis, diabetes, the whole immunology. But let me ask you a slightly different question. So, we obviously have conducted a number of experiments in space. Actually, in a large scheme of things, I would personally argue not many because we didn't have that many platforms, right? It's principally been the International Space Station, and then before that, the Space Shuttle, and then some like other free
Yeah.
flyers. But I think on the ISS, for memory, it's like fewer than 1,000 experiments on the biology side. If you had infinite budget, is there some line of research or experiments that you would immediately finance and go do?
I think it depends again whether we are looking at quick therapies, quick solution for the patients, or whether we are interested in getting to quick business. It's not exactly the same thing. If we are interested in getting quickly fruits, economic fruits, then definitely is biochemistry and protein crystallization, developing new drugs, carrying out preclinical assays in space, and that would be the shorter win. If we look at what would we choose to tackle first for humankind benefit as a whole, I would say research in oncology and
Mm.
neurodegenerative disease. I think that this is where space can quickly bring innovations, and we should make those people aware, the scientists of these domains of oncology and neurodegenerative disease, that there is a laboratory that they probably never thought of using, and that could bring them acceleration and new ideas also.
And actually, I just realized, speaking of the laboratory, I mentioned the ISS, that's the obvious examples. But as some of our listeners may know, for a few years now, we've had another space station, which is the Tiangong Chinese space
Yeah,
station. And I've actually read they have hundreds of experiments also already
I
going
think
on.
so.
I don't know whether you know anything about it. Is there anything you've seen of interesting life sciences research coming out of the Chinese station already?
Not myself, but I know there are quite a few publications. I don't believe they publish everything like everybody else, but
Mm.
I think there are some publications. And yeah, indeed, I think besides the ISS, I think the other big space laboratory is the Chinese. But I wish that someday there is much free exchange between all the space stations. We are not there yet.
Yes, yes, geopolitics comes in. Okay, but speaking of that, I mean, effectively, access to space laboratories. I mean, I guess one exciting news for people like us, and then also for me, my other role as a space investor, is there's now quite a few projects of commercial platforms for in-space experimentation and manufacturing, both entire space stations with companies like Starlab and Vast and Axiom, as well as the so-called free flyers, so not a station, but something like a capsule or some other reusable platform that goes to orbit but comes back. And companies like VADA, obviously very well known, just launched
Yes.
the fourth mission, or the exploration company in Europe was also just launched a mission 2 days ago, SpaceForge in the UK, and a few others. So with these actually commercially oriented players on the horizon, right, who at the end of the day, well, some of them are also targeting use cases like tourism, but let's leave that to one side. A lot of them are actually looking, I think it's fair to say, towards to people like us as potential customers. And is there something when you kind of like a wish list or what these new players should do or look like, or how they should equip their vehicles so that it's particularly
Mhm.
good for research and production?
Yeah, it's like in many of the advanced technological developments, what would be nice is standardization. Standardizing interfaces. Like, for instance, we are making our lab in SpacePharma in such a way that it's agnostic to the type of vehicle. It would be nice if these space stations are agnostic to the type of payload that could be integrated into them. And the one who will be the most standardized will have the biggest chance to fly more people. Of course, cost will be always an issue. We prefer to fly some cheap than expensive, or at least we prefer to fly cheap, even if we have to make a little adaptation instead of too expensive, of course. But ideally, standardization should be the way to go. It should not be that complicated for capsules or for the new private space station to be compatible with hardware such as ours. Most of the companies who like us are developing hardware to do experiment and even production. These hardwares, they are not things like they are not cubic meters. It's much smaller. Our R&D lab is the size of a shoebox. Our first in space factory is like the size of a four shoebox. So it's we are talking about things which should not be too complicated for these companies to integrate. So there is a nice possibility of complementarity. And I am very happy to see all those new capsules and new private space station. I think the future is bright there in terms of possibilities of access and return, because until now, the most complicated thing was to return. Because to go to space, many companies can launch you if you have a nano satellite or even a lab. But to bring it back, which is what we need for production in space manufacturing, then there's as of today, there are still not that many opportunities, but within the next 5 years, we can be optimistic.
Yes, absolutely. And so if you kind of follow this topic along, which is basically about how can we ensure that experimentation and production in space life sciences continues to develop and hopefully scales up a lot. Okay, so we talked about the need for platforms. And again, there's quite a few now on the horizon, and you described some of the things like standardization, which would be nice to
Mhm.
have. Then I guess the other thing we need is specialized hardware. That's where companies like SpacePharma come in and some others. Is there actually anything on the hardware side? So SpacePharma, like you said, has this experiment box, but let's take hardware in a broader sense. Is there anything else that's still missing? I know people are working on all sorts of things. I know some companies are working on DNA sequencers adapted for space. Some have DNA synthesizers they want to adapt for space. I mean, there's all sorts of biological equipment. Is there anything where we're missing on the hardware front?
I don't think so, really. I think
Okay.
uh, I think we have pretty much everything available, in the sense that even not for space, a lot of miniaturized technologies have been developed. As you mentioned, sequencer. There is the Oxford sequencer, which is quite small. There are a lot of new technology which is fairly miniaturized and which can be embarked. So we don't have any, I think, any big issue there, except for one or two key technologies like you would like to do in space, like if you want to do X-ray crystallography in space. Of
Sure.
course, that would be
Yes.
nice, but okay, but it's not absolutely mandatory. So I think yes, indeed, these new technology developments are at hand. We don't need very much. The biggest issue is to have all these life science and health communities aware of the
Mm.
technologies which are available. And so we need to communicate, to find the right way to communicate. So we have this conference you were kind enough to
Yep.
attend and
Health from
participate in
space.
a
Yes.
roundtable on the health from space. And this kind of podcast also is part of the thing we are trying to communicate on LinkedIn. More and more people are aware, but the big pharma, for instance, they are still a bit slow, a bit conservative. There was a very nice space day organized by Johnson and Johnson a couple of weeks ago in Belgium, which means that it start to move. In our projects, we have one which is now planned to fly with Roche. In the US, Merck had flown, Pfizer had done a project. Little by little, Eli Lilly also, as Ken was saying. So little by little, companies are starting to awake, to open their eyes. And so the more we accelerate this process, the more we will solve the key issue of education. And but the technology is there. The technology is ready. The regulation will be in place also at the right time. So I'm not too worried about that.
And indeed, the education point was going to be the next point I was going to ask you about because from what I see, I totally agree with you. That's maybe the biggest to do. And again, thank you for organizing the Health from Space conference in Cannes in France every year. I think it's happened
Yeah, it
three
was the
times so
third
far.
time this year. Yeah,
Okay,
and
again, it's a great conference and one of the, well, perhaps the only bigger event that's really the intersection of space and life sciences. So I think it's a very important event. Since you mentioned the pharma companies, I mean, do you think is it just a lack of education, or do you see when you in conversations with pharma companies that they're pushing back on specific things, like they think, oh, it's still too expensive, or it's still not, we don't know how to do it at scale, or is there any sort of specific concerns they have?
yes, you're right. There is a lot of prejudice in terms of complexity, in terms of cost. People still believe that it's complicated. It will take years to go to space. It's not anymore so complex as it was before. It's not so expensive as it was before. So indeed, there are some of these ideas which are still flown around, but the we have to inform people, but also. People are somewhat conservative. They tend to work with always the same technology, the same factories, and it's hard to change. And so I think, unfortunately, people who will not take the train of space innovation will miss many new markets and even might disappear for markets where they exist today. And so it's our job. We do try to do what we can to inform. But I think, yes, there is a part of conservatism and a part of prejudice.
And then lastly, in these sort of factors that may positively or negatively influence the development of space life sciences industry, what about anything on the regulatory and public policy side you find worth mentioning, or any wish list to public policy makers or regulators how to help develop our
Yeah, you are
industry?
right. Yeah, absolutely. We in our Health from Space conference, we have established a special session each time on the regulatory frameworks. In the conference 2 years ago, we were successful in bringing together the European Space Agency and the European Medicine Agency, which was the first time they talked to each other. Since then, things have been moving, but not very fast, I would say. Again, I think ESA is quite proactive. I understood that EMA is not so proactive because I don't know why. Actually, because it's they are not used to treat these technologies. They believe that it should start somewhere else, not in them. But I don't know. I think this is something that we have to emphasize again and to encourage this dialogue.
Understood. Besides the attending the Health from Space conference, if some of our listeners got interested on this topic of of space and life sciences, is there any other good ways in your mind how you kind of keep on top what's going on and how can people learn more about this?
It's I think one of the good ways is NASA. NASA is communicating quite well, and CASIS, which is the arm of the International Space Station in charge of setting up projects and communicating on projects. So I think the websites of CASIS and NASA are well equipped for informing people on these new applications. But to say the truth, most of the experiments that you mentioned a few thousand experiments which have been flying on the ISS. The majority have been flying out of US companies and US laboratories. And so it's not surprising because the US have access to, I think, maybe 90% of the use of the ISS. Maybe I'm wrong, but the order of magnitude is this one. So of course, it's more complicated for the other countries to send many experiments. There is a selection process, and there is no I would say no barrier, so to speak. But there is just the fact that it's like when different companies are contributing to building the biggest telescope in the world. The time of use of the telescope is in proportion of how many people have been contributing to the cost of the telescope. So it's the same thing in some way with the ISS. Not exactly the same, but clearly the US is a major partner. Europe is a big partner. Japan is a big partner. Russia has been a big one, but we have to be clear. It's much easier to launch experiments when you are in the US than when you are out of the US. And maybe things will change in the future with many private space stations.
That makes sense. Paul, as we're coming to the end here, just a couple more questions for you. One is just if you have a general sort of 1 or 2 sentence closing statement you want to leave on the topic of space life sciences to the audience.
Okay, for me, after my decades of experience in space, I would say without any doubt for me that life science is the next revolution for space. And I would say space is the next revolution for life science. And
Well phrased.
that's where we expect a lot of things happening.
Yeah, I'm biased, and I totally agree with you. And then our last question on the podcast is always the same for every guest, and this is about science fiction and whether you like science fiction. And if you do like science fiction, what is one of your favorites?
In terms of movies,
It could be movies or books or TV series, anything.
I don't look too much at science fiction. The last movie I saw was probably a long time ago, 2001 Space Odyssey. But the reason I am not so much looking at movies is because I believe the reality is so much more exciting than science fiction. I think the reality, even of what we are doing now in life science and space, is beyond science fiction. So, so much to do.
That's excellent. Let's turn science fiction into science reality.
Yes, exactly.
Couldn't close it in a better way. Paul, thank you so much for coming on, and thank you for telling us so
Okay.
much about space and life
Thanks a
sciences.
lot. Thanks a
All the
lot for
best.
inviting me. Bye-bye. Bye.
And that's it for another nominal episode of the Space Business Podcast. And once more, if you enjoyed this episode, please leave us a 5-star rating on your favorite podcast platform, such as Apple or Spotify. You can follow us on Twitter at podcast_space. We're also on LinkedIn under the Space Business Podcast. Lastly, if you have any feedback, including ideas for guests, and that may even include yourself if you have an exciting space story to tell, or are interested in becoming a sponsor, or really for any other suggestions, you can drop us an email at spacebusinesspodcast@gmail.com. Thanks so much for listening, and see you for the next episode.